Good. Okay. Hi, my name is Debbie Kaltman, and I'm from the Healthcare and Science Career Community here at the DePaul Career Center. And I am here with DePaul alum Willie Love from Howard Brown Health, and we're here to talk about his career journey. So Willie, thank you so much for taking the time to talk with me today.
Oh, my pleasure. Thank you for having me.
Yeah. Can you tell us what your job is and what you do on a daily or weekly basis?
So I am a social and behavioral research coordinator. I work primarily on the South Side clinics at Howard Brown Health. On a daily basis, my normal routine is recruiting and screening folks for research projects. If they choose to agree with to be a part of the research project, then I will take them through the research activities, doing informed consent, documenting their informed consent, and then go about the research task. The project I currently work on is a syphilis project focused around men's health. So it includes informed consent, then from there, administering a survey, answering questions anybody has about the survey as they're taking it, mainly creating just an environment of comfortability for the individual so that they feel comfortable sharing that information with me, because it is deeply personal information. Mm-hmm. And then the last little step is just little blood draws and things of that nature, and making sure that it gets off to the correct labs.
Cool. Can you tell me about your career journey and how you came to this job, like maybe how you got it or what interested you in the position?
Oh, that's pretty. So my career journey is all over the place. If I wanted to start all the way back at DePaul, when I originally enrolled at DePaul, I was pre-med. Like most folks came in knowing only, well, if you're going into healthcare, you can only be a doctor, a nurse, or that was really it. So genuinely, if you're going to college and you're studying, generally you get a degree in either health sciences, and that's going to help you propel you to becoming a doctor or a nurse. That was basically my only knowledge. Mm-hmm. After a few struggles with more definitive, like hardcore science classes, I kind of had a change, especially just I wanted to focus more from a community health perspective. And a lot of like medicine is very individualistic, which is very important, but also it doesn't always have the impact on communities that I feel like it is necessary, especially when you're coming from a community that deals with, let's say, institutional discrimination. So a lot of that isn't always tackled by a doctor or nurse. So that's kind of how I got here. I used to intern out of Cook County Jail, mainly out of the Cermak Hospital. So it was the on-site hospital for Cook County, and I was working with HIV positive patients. So then that's kind of how I got started in this, basically working with a lot of STDs and doing research. And then graduated from DePaul after working up north at Baxter, another healthcare company, doing customer service for about a year. Once I graduated DePaul, transitioned over and just saw this job opening, and honestly got in the room, didn't know much, and was blown away by the team and just like the things that they wanted to advance within healthcare, especially for LGBTQ folks. And that's kind of how I got here.
Cool. What do you find most rewarding about your job, and what's most challenging?
I think the most rewarding and most challenging thing go hand in hand. The most rewarding part is just talking with patients, understanding their story, being not only a voice at times for them when the world isn't like kind of listening, or specifically when institutes, so like healthcare institutes aren't listening or just aren't treating them with the due respect that they're deserving. But that's also the challenge of it is you're dealing with a lot of trauma, not only from an individual that may have experienced trauma for 20 plus years within the healthcare realm, but also their mother has, their grandmother has, it's generational and it's deeply embedded within the family structure at times. So dealing with that mistrust of healthcare practitioners, especially public health practitioners, is kind of that challenge. But being able to like listen to people's stories and convey that into the appropriate words for other individuals so that funding may be provided to them to do certain activities or to do certain things. That's kind of where I stand.
Yeah, that definitely makes sense. That what's most rewarding is also most challenging, the human and the community aspect.
Yeah.
Willie, you talked a little bit about your DePaul experience coming in kind of pre-med health sciences, but can you talk about some other impactful activities from your undergrad? It could be jobs or classes or research or internships or student organizations, like anything that was really important to you.
The first actual, most College of Science and Health majors kind of understand this. Once you go through your classes, especially once you get into your junior level and senior level class, you start to do your own like projects. Even on the class level, they're pretty informative, and they kind of help set the groundwork. They lay the groundwork for like coming research activities. But one of the bigger things was working with Dr. Douglas Bruce on a research project that we did. And that was my first like deep dive into research. It was secondary research. So it was looking at data already collected, very much different than what I do now, which is where I'm collecting the data. It was one of my first jumps in that. And that was done, I was doing that internship in conjunction, I was doing that project in conjunction with my internship at Cook County Jail, which also was very informative just on how research is perceived by individuals. One of the things that gets lost in translation a lot of times when we're asking individuals to give us information is, well, what will we do with their information and how are we giving back to them once we like actually do our research? What are we disseminating back out to folks? Those were some of the bigger things that I learned very early on were very important to the role of being a researcher, at least for me. And at least for me and the individuals that I kind of gravitate towards within this research space is how do we disseminate that information back out to the individuals that gave it to us? How do we show them that their information was appreciated and it won't be abused, but it will be used for what research is supposed to be for, a greater purpose.
Sure, that makes sense.
So the Cook County internship was very, very informative for that perspective.
Sure. And how did you find that internship, or how did you get that internship?
Honestly, it was my mother worked out of county, and I just asked her to ask around, and then she asked around, and Desiree Carter Peterson, who I owe my career to, she brought me in for an interview, and she was just like, what do you want to learn? And we basically had a discussion, and then she took me on as an intern for about a year.
Wow. That's really cool.
And I learned a lot about just not only because I was coming in from a research perspective, but I learned a lot about community aspect from that perspective of like, research is great, but also how do you connect with the community and make sure that they feel respected by research? Because a lot of times research feels like, hey, let me just get some information out of you and then bye, get out of my way. So how do you make that more of a cohesive bond, right? How do you make sure people feel that they're giving their information to something that's actually impactful?
Sure. Yeah. What advice do you have for students who are interested in exploring a career in community health?
Try everything. Try it. Honestly, if you go off what you perceive or like your preconceived notions, you might be more limited. But once you try something, especially in healthcare, there's a lot of different avenues of growth that honestly you don't know until you get within the actual field. It's not you even as like a healthcare administrator, there are so many different things you can do and so many different impacts you can have, not only on like a large scale, but even on a small scale. A lot of individuals, especially if you're coming from a community aspect, definitely just try it. Try to learn new things. A lot of healthcare is knowing one thing and being able to practice one thing and then translating it over to something else. And like I'm going from one project, I'm transitioning from one project to another, and all the skills for the first project was basically very focused on the ground approach. How do you connect with individuals? How do you make sure individuals feel comfortable within a room? And then how do you make sure you're doing the research task in the most appropriate way that they can comprehend that?
Sure.
And now I'm transitioning over to a space where I'm helping build the research from the ground up. So how do I implement those aspects that are important of actual researchers being able to do their job on the ground and implement that into the actual research from the start so that researchers don't have to come back down the road and be like, well, this would have been more helpful early on if we would have just implemented this little small thing. So try everything, and honestly, you don't know where it will take you, but just be curious. Especially, and then I think the other aspect is, especially if you work from a community health perspective, understand your boundaries and understand your worth as well, because there's sometimes will come times where as a community health person you care, and as a caring person you can sometimes become too involved, or you have to understand when to establish those boundaries and step back from something for a brief time and allow other individuals to come together. I would say the last part is that's very, very important. And I didn't stress it enough in college because I wasn't a group individual, but learning how to work in a group is very important because there's only so much you can do as an individual within a certain role within healthcare to actually provide for a patient. And there's a lot of other ancillary support staff that can be of great assistance to you if you have the proper communication skills to actually just talk with them. And I think one of the bigger things with that is if you're not as like versed on it, honestly, just starting with honesty and just saying, hey, I have a struggle with this patient right now. Do you think you can point me in the right direction, and just be as nice as possible and honest? And I think that'll lead you in a really good path with just establishing those team working skills.
I like that, being exploring and being curious, but also being really humble about what you don't know. One more question. So when we have another interview again in 5 years, in January 2027, what do you hope we can talk about in terms of your career?
I think one of the bigger things for me is being able to truly understand the grant writing process, because that essentially starts a lot of funding, and being in the process of, if not already having certain mental health clinics established in certain like areas of Chicago, mainly like the west side of Chicago, if not already having those established, being very definitively on the path within the next 2 to 3 years after that to have those established and have an appropriate team to actually be able to work on those, work at those sites.
That's awesome. Cool. Well, thank you so much for sharing your experiences and your insights, and reminding our students to be curious, to try everything, to explore, to be open-minded, and to remember that it's really important to work as part of a team in healthcare.
And I thank you for having me. I'm not much for I haven't done many of these interviews, so it's still kind of new for me as well, but also learning as much as I've learned these past few years, it's always important just to give that information back.
Yeah, thank you.
Mhm.